As one of the first countries to enter an aging society, Singapore is also one of the first to rapidly respond on multiple frontiers through cutting-edge research, world-class hospital care, and policy initiatives. What can the rest of the world learn from Singapore's experiences? Let's welcome Yap Seng Chong, Dean, NUS Yong Lu Lin School of Medicine, Chief Clinical Officer, A-STAR, Daniel Fung, CEO, Institute of Mental Health in Singapore, Chien-Ern Lee, Deputy Group CEO, Regional Health System, Sing Health, Andrea Meyer, Co-Director, Center for Healthy Longevity, National University Health System, Singapore, and Session Leader Brian Kennedy, Distinguished Professor in Biochemistry and Physiology, the Yong Lu Lin School of Medicine, National University of Singapore.
Thanks for joining us today. This is a discussion about how Singapore is approaching the rising challenge of aging in 2022, and what are the challenges facing a small country in Asia, what are the opportunities, and we have a great panel today to discuss this topic. First of all, I'm Brian Kennedy. I'm Director of the Center for Healthy Longevity at the National University Health System and the Healthy Longevity Translational Research Program at National University of Singapore Medical School. My background is really doing preclinical research and basic research to understand the aging process and to develop interventions to slow aging and extend human health span. I came to Singapore about 5 years ago because I recognized that this is really a great place to try to understand and deal with the demographic change facing the world in this century. The world is getting older rapidly, and I think the challenge of aging is really the biggest medical challenge facing us during the first half of the 21st century, and we'll be talking about that today in some detail. I want to introduce our panelists, though, and give them a little bit of time to talk about their interests. So first of all, I want to start with Dr. Lee Chien-Ern, who's the Deputy Group CEO of the Regional Health System at Sing Health, and has really focused on population health and wellness. And so maybe from that population health perspective, Chien-Ern, you can tell us a little bit about how you at Sing Health are approaching the transition from middle age to seniors.
Yeah, thanks, Brian, and thanks. Happy for this opportunity to be here. And in Singapore, as you know, we are a rapidly aging society. And I think one of the key areas that we are working on is, and the approach that we have taken is in terms of three stackable modules. First is to anchor care in primary care. Secondly is to outreach and to move from just looking at patients to the resident population. And third is to get empowered, what we call a community of care. So you could see us characterize it as moving from patients to population, and then from doing things for people to doing things with people. And hopefully that our population can get activated and empowered and be able to do as many things as possible by themselves too. So I think we, as our population not only ages, but also our socioeconomic status changes, educational level changes, I think we have to adapt accordingly for that. Thanks.
Yeah, I like to say that it's moving from sick care to health care, and it's much more preventive and active participants on the part of the community. And so, I think that's what you're trying to say, right? That it's really more of a process of empowering people to stay healthy as much as possible.
Yes, and also a key element of that is the outreach, because currently we are managing those that we know, but there are groups out in the population that we do not know of, or those that we know but have been lost to follow up. So how do we reach out to them? And also, how can we move more upstream? Because I think we also know that it's not, in terms of individual health outcomes, it's not just the healthcare that matters, but the social determinants of health and lifestyles. And I think there was a paper in Lancet several years ago that asked the question, should non-communicable diseases be considered a socially transmitted disease because of the importance of the lifestyle factors? And also, that a lot of things now start even in the womb that affects what happens later. So I think in terms of moving upstream, it is not just moving more towards prevention and out into the community, but it's also in terms of taking a whole life course approach and addressing what really matters to our population and individuals at different points in their life cycle.
Yeah, that's great. It's a great transition too. So I want to bring in Dr. Chong Yap Singh, who's the Dean of the National University of Singapore Yong Loo School of Medicine and the Chief Clinical Officer of the Singapore Institute of Clinical Sciences at A-STAR. And you know, your research career was largely focused on cohort studies on early life, Gusto and Espresso, which are very successful cohort studies. And so, you know, now you're, you know, dean of a medical school and the population is aging. And so how do you think about the aging challenge and what can Singapore do about it?
Thanks, Brian. So actually what I think is an immediate challenge is, and probably of most interest to me, is helping people to look at aging in a different way. So the traditional way people look at aging is that, let's say, if it's chronological aging, right? So if you're born in 1950, you'll be 71 years old today, right? And there's no question, there's nothing there you can do to change that. Okay, but that's chronological age, just simply the time you've been alive, right? But then what Shannon was talking about was that Singapore is fast aging as a country. So Singaporeans don't age faster than anybody else on earth. But basically, as a population, the demographics are changing in a way that where the population pyramid is shifting, so that instead of having more people who are young, they are having now more people middle age and older. So that's simply a function of the fact that we are not replacing ourselves as fast as we used to. So the reason why Singapore is aging fast is because our total fertility rate has dropped dramatically. So you need to have a total fertility rate of 2.1 to basically replace yourself. Singapore is now at 1.1. So basically we're not replacing ourselves. And at this moment in time, there are more people above the age of 65 than there are people, young people. Currently, we have 4 to 5 young working persons supporting one person over 65 years of age. But in 2030, you'll come down to 2 working persons supporting an older citizen. So that becomes a problem. So that's the second way of looking at aging, demographic population point of view. But then what you, Brian, and Andrea talk about when you talk about aging is biological aging, right? So that's a situation where a person has accumulated various biological insults to their system and damage, so that they basically start to show the age. And a 70-year-old person can, be active running marathons, or they could be already wheelchair bound. So that is the biological age, and that's the age that Brian is talking about, when that you can try and change. You can slow it down or even reverse it slightly with the right measures. And a lot of the measures are going to be lifestyle measures like exercise and dietary measures, as well as possibly some pharmaceutical, nutritional measures. So, I think if people start to look at aging as something that is not fixed like a chronological one, or simply a population shift, but one that is individualized to the person and can be modified through interventions early on in their life to reduce the damage that they accumulate as they pass through time, then I think that's the one exciting thing we can contribute to society, that we can start to live in a way that allows us to arrive at the age of 70 or 80 in a much healthier state than we would if we didn't pay attention to what we did. And that's the idea of then increasing health span, which I think is probably the biggest fight that we will have. All the other measures like improving the environment so that people can age more comfortably, and then increasing employment into the older years, those are important things to do, but they are just patches. And we can't do enough of that to really change the situation. What we really need to do now is to get the population to start living more healthily, so that they have a better health span, and a shorter time in morbidity before they reach the end of their lives.
Thanks, Jeff. Yeah, I want to bring in Dr. Daniel Fung, who's the CEO of the Institute of Mental Health in Singapore, and he has set the record. He's affiliated with all 3 medical schools in Singapore, so I won't go into all of that. But really, his focus is on mental health, and maybe you can comment a little bit on the mental and cognitive changes with aging. You know, we all think of dementia, but we tend to ignore things like depression and many of the other challenges that seniors face. So please let us know a little bit about that.
Thanks, Brian. And I suppose in line with what Yap Singh had talked about and what Chen has mentioned, I'd like to think of, we are all physicians, and we take a medical approach towards a lot of issues and problems. And the medical approach is very individualized, looking at the individual. And yes, we are rapidly aging. That is a fact. But does aging have to be seen as a medical issue, a medical problem? Is it more important to think of aging as part of development? Now, Erickson described the old age as a stage of development, the 8th stage, and it actually he talks about whether there is despair versus integrity, and that at this stage of life, is it a time for reflection, and where the outcome is wisdom? And a society that's rapidly aging, it can be seen as a society that is actually developing much more wisdom, and that the individual who is older doesn't have to be a problem. The individual you can think of development and growth. Yes, in terms of illnesses, dementia, above age 60, you're talking about 10%. That was a data in 2013 in a large-scale study that we did in IMH. The prevalence of depression was about 3.7%, and that if you consider the subsyndromal depression, it's 13%. This is still the minority. The majority of people do not have mental illnesses. And life, since we have Yap Singh here, life is very often described as cradle to grave, but we know that life starts well before the cradle, 9 months exactly. And after the grave, after life, and I'm not talking in religious terms, I'm talking about the life of those you leave behind. And leaving well, as much as you've lived well, is incredibly important. And how do you do this? I think it is about the development and growth of this period of time, and whether we can develop good roles, what are the routines, and most importantly, what are the relationships? Because no one is an island, even though Singapore is an island. We are part of a family.
Yeah, no, I think that, I've heard a couple of themes already, and one is that this is really a life course issue. It's not about targeting just the frail population or elders, but it's about understanding the changes that happen throughout life and helping people to go through those transitions as well as possible. And so we'll come back to that a little bit. I want to bring in our last panelist, Dr. Andrea Meyer, who we're very fortunate to have. She has come to Singapore recently. She's co-director of the Center for Healthy Longevity here at NUHS. And she's really been a leader both in research and medical practice in the gerontology space. And she's run medical practice in that area in both the Netherlands and Australia before coming here. So you have sort of both perspectives, the research and the medical perspective. And maybe you can talk a little bit about the biology of aging and what do you think the approaches are to deal with it.
Yeah, thank you very much, Brian. I think everybody knows that there's lots of evidence already from animal studies that we know why we age and what the aging mechanisms are. And we really understand on cellular level what's going to happen while the clock is ticking. And I think now it's really time to bring that to humans and to really change how healthcare is positioned nowadays, because it was already mentioned by Brian Kennedy, it's really sick here and we should move towards preventative care. And what's very important, I think, that we shouldn't wait until a disease occurs. For example, at the age of 60, 60% have at least 2 chronic diseases at the age of 70% of the population have suffer from multimorbidity. So I think what we should really try to achieve is to maximize the bodily functions, how our body is functioning during the life course. So at the age of 20, 30, 40, etc., and not waiting until we have so much damage that as physicians, we call it a disease. And then, of course, it's a question how to do that and how to achieve that. And it was already mentioned that there is not only chronological age, but there's also biological age. What we are working on here worldwide are biomarkers to measure the biological age. So really, how is your body functioning? What is the pace of aging? And how is the body reacting to so many things, which were already mentioned, like the environment or social stress, working environments, etc. And also, of course, what's your genetic makeup? And then, of course, while having these biomarkers and to measure biological age is very important to do something. And these are the interventions. And we have already interventions in hand. And that's, for example, lifestyle. Healthy food, lots of physical activity, which really lowers the biological age already. And then, of course, and I think Singapore is really positioned to be in the lead in the end, to have also medication studies to see if we can pharmacologically lower the biological age in humans, in the society. And why is Singapore such a, I would say, strong partner in the field of longevity? Because we have so many links with government and with industry and then academia. And bringing these forces together, I think we will be able to lower the biological age of individuals during the life course.
Yeah, it's really a challenge, isn't it? It's really changing the course of how we think about medicine, and it involves a partnership really between the private sector, the government, the researchers, and the clinicians. And trying to, turn that ship is a challenging thing. And I think both of us see Singapore as a big opportunity to do that. Maybe I can start more at the personal level, and then we can move out to the population level. So this question is kind of for Andrea and Daniel. We talk about physical aging, and we think of sarcopenia and frailty. We talk about cognitive aging, and we think about dementia. We think about other challenges seniors face from the mental health aspect. Is there really a difference between physical and mental aging? How much interlinked are they? Maybe you can start with that, Daniel.
It's a huge interface between them, because we already know that if the mental function is not well and you are not feeling good, then of course also that reflects on your body functions. For example, on the immune system. We know if there are stressful situations, then for example, you are much more likely to have an infection, for example, or influenza, and you will be sick. So we already know that these really go together. And I think this is also very important if we talk about interventions, how to lower the biological age, that we not just are focusing on the bodily functions, because we know how cells work, but that people are also happy. And we know from very big studies, from cohort studies of centenarians, for example, they say, yes, I love how I live my life and I'm happy. And the people who say, yes, they are happy and they're mentally well, they're very well embedded in society, they also live longer. At least that's what epidemiology and the data are telling us. So it's very important to integrate that.
And Daniel, do you want to join in?
Yeah, well, I still feel that very often we pathologize the things that we are looking at in terms of life, and of course, if you study cognitive functions, you will see that there is a decline. But if you look at creativity, for example, you will be very surprised. A lot of us assume that creative individuals are young. There's been studies suggesting that creativity is maximized, particularly in the humanities side of the house, in the 70s. And there's lots of evidence that suggests that there's a lot of, mental, your mental age isn't affected. In fact, it becomes more pronounced and better. So I think although pathogenesis is important, and there are illnesses that we have to be aware of in this age group, and multiple illnesses, a lot can be done in this area, I still feel that the importance of focusing on health and the origins of health, what I call salutogenesis, well described for a long time. What are those things that are important? We need to do more studies in those areas. The people who live long and are doing well. How do you help that? And it has to do with also the environment that we're living in.
You mentioned empowerment earlier, and I think that's a big component. Seniors want to feel like they are still contributing in ways that support their families, support communities, support society. How do you find ways to increase empowerment in Singapore for seniors?
Well, I mean, you have to make... I'm a child psychiatrist by practice. So when I work with kids, we try to make their world easier. So what we need is a world that's easier for the elderly. For someone who is, maybe they can't move as fast. How do you make that world more convenient? I've always told my wife, and by the way, I'm a grandfather of one, and as we manage our grandchildren, I would love to have a device which I could wear on me and help me to walk better, as quickly as the young person perhaps. And then that's probably what you want to do. Create a world where things are convenient and easy, and there is a sense that they can do things for themselves. One of the conversations I often have with my patients and myself also with my family is, who's going to take care of me when I'm older? But do we need people to take care of us? How do we create that better environment? And empowerment means creating that elderly-friendly environment. In IMH, and I believe that Chenan will talk of this as well, we try to create healthcare facilities that are elder-friendly. We need entire societies to look at these different aspects of our lives. And I think we have technology today that can help this, both at the personal level and also in large scale for the environments in which we live in.
Excuse me, maybe Chin-Yun, you can comment on that. I know you've been focused on those aspects and technology and how it can assist seniors.
Yeah, I would agree very much with Daniel on that. We need to understand what makes for not just productive aging or healthy aging, but what makes for meaningful aging. What really matters to our population and our elders and our seniors. And I think one of the key questions that we have to address is to better understand how they live within their natural environments. Because while we try to make our healthcare institutions as elderly friendly as possible, it is nonetheless still a rather artificial environment. We have nurses who help them. The diet is more prescribed, and the medications are at determined times. But how do they function when they are at home, when they are interacting with their friends, when they are with their families? So I think that is that part that we really need to have a good handle on, because each person will have different needs. Some may be more introverted, some more extroverted, but each would have what drives them and what keeps them going and what would they like to do. So I think taking from Daniel's point, if we could, from the research perspective, how do we marry the insights from science and turn it into our services? So in SingHealth, we have two centers that are working on this. One is our Center for Pop Health Research and Implementation. And one of our projects is looking at the life space of our seniors, where we try to understand the impact of the environment, the health, and the social. So both the physical and the social environment of our community dwelling seniors. Can we better understand it using sensors, using interviews and multiple tools, and to understand then how do they live their lives? And the other part is our Center for Healthcare Assistive and Robotics Technology chart, which tries to develop technologies that can help us to be, not in this era of Internet of Things, to be unobtrusive, respecting their privacy, but yet at the same time being able to not just gather data, but perhaps give the necessary nudges, give the necessary reminders, so that not only to them, but maybe to their caregivers. So in Daniel's words, to make life easier for our elderly, and not just for the elderly, but for their caregivers and for their family members, and to enable the interactions that matter to them, to enable the life that they find fruitful and meaningful, regardless of which age or which stage, or even which physical ability or disability that they have. Thanks.
Yeah, it's really also an outreach problem. I think that you mentioned that earlier, and it's how do we communicate to the people that to think about aging in a different way. And you know, I don't know, maybe you can, Yup Singh, talk a little bit about from a medical school perspective, you know, how do you approach this changing demography?
Thanks, Brad. As I mentioned earlier, I think it's all about relooking at aging, right? So when Singapore became independent 56 years ago, 1965, the life expectancy at birth was 67 years. Currently, it's 84 years. Right. So basically, we've gained an 18 extra years of life. This should be can be considered a longevity dividend, right? So that's you know, that's a good thing. I mean, if you have an extra 18 years, you can, if you're allowed to work and be productive, we can, you know, earn a lot more money. If you have a meaningful life with your family and friends, it's meaningful longevity as well. So the only thing is that there are two main challenges here. One is looking at how we see the role of older people, right? Do we impose a mandatory retirement age on them? So, you know, the mandatory, retirement age back in 1965 was probably 62 years of age, which makes sense when your life expectancy is 67, you know. But right now, when it's about 84, is it still reasonable for people to retire at 65 or 62 or 70 even, if they're still healthy and working well? Because once you stop working and you're sidelined, there's always a higher chance that you become increasingly isolated socially, and then your functions will start to diminish. So one of the first challenges is to really rethink how we keep people engaged in society, engaged at work, and engaged in being productive. So that the buzzword now for aging is healthy and productive longevity, right? And of course, Shannon added meaningful longevity as well. So I think that's one of the first challenges, really looking at the role of older people. They are a great source of manpower that we seem to have marginalized, when actually they can be still creative and contribute very, very significantly to society. The second challenge is the fact that, okay, so we have 18 extra years of life now. The trouble is that between 8 to 10 years of those lives are spent in ill health. So because of our, there's always a gap between healthy life expectancy and life expectancy, and the gap is about 8 to 10 years. So the question is, can we reduce this gap by half to maybe 4 to 5 years instead, so that you can have, instead of 10 years of healthy life extra, maybe have 14, 15 years of extra healthy life. And so that obviously adds to your well-being and that of your family and society. At the same time, if you reduce the period of morbidity, then you reduce the burden on the economy and society by reducing healthcare costs. So the second challenge is one where you will require more innovative biological approaches to scientifically understand what drives healthy longevity. How do you modify biological age? The first challenge is more of a sociological one, where we look at the roles of older people. So those are, to me, the two challenges which I really like Singapore and every society to really look at very carefully and seriously find ways to fix them.
Yeah, I think that's the real thing. We talk about life expectancy going up, and we think of that as a great thing, and it is in many ways. But when lifespan is going up faster than health span, you're also increasing that period of morbidity. You're increasing the cost. You're lowering the quality of life, and so Andrea, how do we focus on health span?
That's a challenge, but I think it's doable. I think there should be a mind shift, especially in the healthcare sector. That's on the one hand side. On the other hand side, a change of how we look at our body from a societal perspective. Everybody here also in the room. So, as I mentioned, we are waiting. Our healthcare system is waiting until there is a disease, and we do not focus yet on prevention. Once the blood pressure is too high, once the glucose level is too high, we call it a disease. However, the disease, of course, is already progressing 10, 20, maybe 30 years already before that. So, and to enable that we are aging more gracefully and extending the health span, we really have to interfere with bodily functions already earlier in life, which means already at the age maybe of 20 or 30 or 40, to see how we can delay the aging process by either lifestyle approaches or by pharmacological approaches, which are or could be available quite soon. And therewith to extend the healthy lifespan and to delay the onset of a disease like diabetes, like hypertension, maybe even cancer. And I think, as I mentioned beforehand, there is so much evidence already from animal studies, and the time is really now to test that in humans. In big cohort studies, but especially in interventional studies. But while doing so, I think there has to be a mind shift in the healthcare system that we focus really on extending the health span and on prevention. And, you know, I am an internal medicine specialist, and I think having a specialty like longevity medicine would be wonderful to integrate this prevention aspects into, for example, internal medicine or in general practice in the primary care sector in the end.
Yeah, and really the concept of aging has not reached medical schools to a large extent yet. You know, when I was teaching at University of Washington, you know, I'm not an MD, by the way, just to let everybody know, but I was teaching medical students about biochemistry, and we'd talk about aging, and that was the only knowledge of aging they got, yet it's the biggest risk factor for most of the things they're going to treat. I mean, and also the interface really for most of the people in the community is not the specialist in the hospital, but the primary care practitioner. And so how do we communicate between clinicians and general population to evoke things like lifestyle change?
That's of course also a challenge, because in the end we have the healthcare system to treat a disease. So why would you invest as a person, as an individual, into prevention if that is changing your lifestyle, for example? Why should people move more if we know that this is preventative for diseases? But of course, it costs some change of your way of living. It's a difficult question, but I think Singapore is really at the edge to achieve that with public health approaches.
I completely agree with you. I think prevention is a big area, but you can't. It's such a big issue, and yet it is. We say it without actually some action. What we probably need to do is to ask our physicians, are you willing? And recently I've asked that of my psychiatrist. Are you willing to spend 20% of your time seeing and treating patients and 80% of your time trying to prevent illness? The skill sets are different, and you probably have to train for that in terms of coaching people. Lifestyle change is not about prescription. It is about telling people, look, think about your life. What do you need to do to keep your health and maintain it, and what are the things that promote health as much as it is about preventing illness. And I think those kind of changes requires a complete mindset shift. I only see the doctor when I'm sick, but perhaps you should be starting to treat the well. And that's really the purpose of population health.
Yeah, I agree with that. Yeah, please chip in.
Yeah, if I may chip in, I think following from Daniel and Andrea's point on the preventive part, I think sometimes when we see a patient and we think that because everything looks good. You say there's nothing else I can do for you. But that may be thinking of it more in terms of the medication perspective. But I think increasingly we should increase our repertoire of what we offer to our patients. And I think in Singapore and around the world, there's a movement where exercise is considered medicine, and where, because we know your mobility status and how active you are does affect your health, and how do you then prescribe medicine in a healthy way, in the right way. And the other part is also about social prescribing, about recommending how to keep our people engaged. It could be to the library, it could be to gardening, it could be certain activities. But that, I think, in it requires that mind shift for us to think of, as healthcare practitioners, what can we actually offer to our patients, offer to our residents beyond what we are currently able to give, and expanding this repertoire. And I think that another area of the mind shift is also moving from just thinking of what are the gaps in terms of what they can't do or what are the diseases that have, to looking at what we call intrinsic capacity or intrinsic capability, what they can do. Because I think to empower someone, I think it is always more encouraging when you tell me, hey, you can do this and you can do more of this, especially if you like it, rather than being told this is what you can't do, this what you can't do, this what you can't do. I know all the no's, but what can I do? So I think that's something that we need to work on, and that, I think, carries forward in terms of our engagement with the community and the environment in which our seniors and our population live in. And I think learning from the social sciences, learning what we call the ABCD approach, the asset-based community development, where we again see what are the strengths in the community, how can we leverage on it, and then how can we work with each other under focusing on what the gifts that each of us have and are willing to contribute, and then building that community and building that society that enables the meaningful, healthy, and productive aging.
Yeah, I think that one of the problems with, you hear a lot that prevention doesn't work well, and one of the problems is that we don't recognize the personal component of it, and that if you just tell everybody go exercise and eat right, that doesn't fit people's needs. You have to work with people to find sustainable lifestyle changes and convince them not only that it's good for them 20 years from now, but it's good for them now. They'll feel better and have more energy and now. And so I think that we tend to trivialize what we tell people in terms of prevention, and we need to find ways to put more time and effort into personalizing that for each individual so that they find some path toward a healthier lifestyle that is sustainable for them. Maybe we're starting to come to the end, so maybe I'll just ask people to think a little bit about the future and where you want to see Singapore, say 10 years from now, in terms of improving the lives of seniors, compressing morbidity, etc. Andrea, you talked a lot about interventions. How fast can interventions be validated in humans, and how fast can they get to the community in Singapore?
So I think we need 1 to 3 more years to have the first results of randomized controlled trials, which is the highest standards, of course, to test if interventions work. For example, using small molecules, new medications to test, but also lifestyle interventions. I think Singapore can be on the forefront really if we would have positive results, and we already have worldwide a couple of smaller studies which are very positive and in terms of lowering the biological age. And I think then Singapore can quite nicely, or could quite nicely, implement these changes into healthcare or into the community. There are a couple of approaches in Singapore, of course, where locations are really being transformed to see how we can adapt lifestyle and change lifestyle and change healthcare systems. So maybe if you ask me what's a time frame for implementation, 10 years of time, my own KPI is really to hopefully to integrate longevity medicine into clinical practice in the next coming 5 years. And that means that we can test the biological age of individuals, and we have the first interventions really being implemented into, for example, outpatient systems.
Maybe I'll go to Yap-Sing next as a transition. You talked about integrating into clinical practice. How do you see sort of longevity medicine falling into the clinic?
Thanks, Brian. So yes, I think doctors, healthcare practitioners haven't really come to embrace the idea of biological aging yet. So I think it's important for them to come to terms with that idea that you can modify age biologically with the right kind of lifestyle and maybe pharmaceutical interventions. And then we can maybe start to see that being more of a clinical practice. But I think, you know, tackling aging, we have to move well beyond the healthcare sector. The government has a major role to play in the way they engineer the environment, physically as well as sociologically, you know, and maybe in employment terms as well. So I think there are lots of things to be done there. And Singapore actually is one of the first countries in the world to really look at aging carefully as a population problem. And they have started many of this environmental and social engineering efforts. But I think that they need to take one extra step, and that's to go into the scientific realm of aging, and to really invest in the research into aging and what we can do about biological age. So I think many countries, I mean, you know, a lot of the research that Andrea was talking about has been done in the West, but very few Western countries have actually brought this science from animals into humans. So I would like to see Singapore doing that very boldly, because our demographic shift is so fast towards the aging that we really have not much time left to wait around for other people to show us the way. I think we have to take the lead ourselves, invest in the science of aging, and see what we can meaningfully do to that. We're already doing a lot in the social and environmental space. I think we need to do more in the scientific space.
Yeah, I think that's true, and you can look at what's happened in the private sector recently. I mean, the private sector has moved heavily into longevity research now, both in terms of measuring biologic age and trying to intervene to slow or reverse aspects of aging. There's companies all over the world. They're becoming well funded, and I think we need partnerships with governments that really step forward. We're trying to bring some of those companies here to Singapore, and it would be a great opportunity to really step up and trying to address this issue. Shinner, you talked about you know, that we should be working with well people. I don't know about treating well people, but we want to be helping well people stay well as opposed to seeing people after they get sick. How do you imagine over the next 10 years or so seeing health changing to be more community minded like that?
I think my dream is the ability for us to be able to link up the scientific advancements, which I think Yap-Sing, Andrea, and Daniel has spoke about, and be able to translate it and having a mechanism to turn it into day-to-day reality from what happens in the lab, from the genomics, the animal models, to the individual, the pathophysiology, moving on to the individual's social environment and the lived environment, in terms of their household, their family, their physical environment, and into the population. So I think the various components are actually already in place in Singapore in various shapes and sizes. So I think the challenge is the ability to link all this together and be able to translate them into meaningful intervention at pace and scale. So I think that's my actually dream, to see how can we in Singapore turn this, and also working from across the life stages, as I shared earlier, from all the way from the womb to the cradle, and so that it's a dignified living, because aging doesn't start at 60. Actually, every moment that we are here, actually we age a minute or a second. So I think we have to then see how can we address it in a meaningful way.
And then finally, I'll give you the final word, Daniel. So you mentioned things about creativity, wisdom. How do we bring that out in seniors in Singapore? What's the future for this?
Well, thanks, Brian. I was going to talk about really how we are using science today, and we study, and Andrea mentioned randomized controlled trials, which is a way of studying illness. Is that methodology the ideal methodology for understanding aging, and whether we should consider, for example, Yap Singh's cohort studies are wonderful, but we have an entire cohort that we are able to study. It's only 40,000 births a year. If you study those cohorts and use that data, so I'm suggesting that for us to be a truly smart city, to think about taking that data from the smart devices that we have and then turning it and using that to give us better insights into, we've talked about it, right? There's the social side of the house and the biological side. If you could collect the data, have ecological momentary sort of awareness, identification of people's lives as they go on, and today we have a lot of these monitoring devices digitally, you might have a better understanding of large cohorts. Today, there is not enough of using that data, which in Singapore is fast happening. Really, the science of data analytics and big data and how you can use it to then inform us on dealing with the aging issue, including the biological side of the house. And I'd like to see that. And I believe at the end of the day, it is about creating responsibilities for the elderly and independence that will make their lives better. I think that they need community and socializing, and there's a lot in terms of what we have. We are the second most digitally connected society outside of the US, and we have the opportunities and I suppose the wealth to do this well. So,
yeah. Thank you. Thanks, everyone. And just to close, I see this as a huge opportunity for Singapore. People always talk about silver tsunami and all the bad things of aging, but this is really a nation that's poised to really tackle this problem and bring out the best and that seniors can offer, and so to contribute to society and to also contribute to their own wellness. We talked about it both from the individual level and the population level, and I think there's obviously a lot of challenges. It's a multifaceted problem, and we have to have a holistic approach to it that involves academics, government, and private sector. It's just great to hear, so many great minds in Singapore thinking about this problem from different perspectives, and hopefully we can bring it together and really create meaningful change on the island in the next 10 years. Thank you for joining us, and I hope we can do this again soon. Thanks a lot.